generously, 9 to 12 a day for years. And I've never had dry skin, and I've never needed a moisturizer. I'm 55 years old. I've never used a moisturizer. My skin isn't dry anywhere. Now, as far as why I have a different opinion than other nutritionists, it really is much ado about nothing. I have my own opinion. There's no textbook, and there's no factoid or encyclopedia that tells you yes fats, no fats. When it comes to nutrition, when it comes to the nutritional value of fats, when it comes to how we address our dietary needs, our supplemental needs, we really have much bigger fish to fry than worrying about whether one nutritionist says yay or one another nutritionist says nay. For us to worry about oils when we have all the health challenges we have, it's like autoimmunity and obesity and blood sugar problems and accelerated aging. For us to worry about whether an oil is good or bad, it's like worrying about a mosquito flying around your head when you have an elephant flying around your roof. It misses the point of what I call the bright side philosophy, which is the idea that we have control over our health. If you eat an oil, if you eat vegetable oils, and or any kind of oil for that matter, and you don't feel good, you probably have a problem absorbing that oil. In any case, you're going to have to eat oil. There's no way to get around it. And when nutritionists tell you not to eat oils, they're giving you their opinions. And at the end of the day, we should all be forming our own opinion. Now, of course, Dr. Wallach has the advantage of having worked with thousands of patients and researching for 50 or 60 years. I'm still relatively wet behind the ears. I've only been researching for 30 years. But I got a certain amount of experience as well. And ultimately, the proof of the pudding is in the eating, which is to say, you got to decide for yourself. I'm sharing with you my opinion. Other nutritionists, including Dr. Wallach, is sharing with you their opinions. And that's pretty much all it is. It's our opinions. And you got to form your own opinion. Take all the facts, assess them for yourself, test things out in your body, see how you feel, and make your own opinions. I hate the term doctor's orders, or my doctor put me on, or my doctor wants. We have this idea in the world of health that we don't know as much as our doctors do, or we don't know as much as professionals do. We have to make our own opinions. We got to weigh all the facts, assess all the facts, first accumulate the facts, and then assess them and weigh them out, and then test things out. All right, so enough of that. Back to keeping our skin healthy. I've been studying skin for a long time, and as a pharmacist, compounding pharmacist, I formulated and dispensed countless of my own skincare formulations for aging skin, wrinkled skin, dry skin, rashy skin, burnt skin, post-surgical skin, wounded skin. And what I've come to realize is that the strategies for keeping the skin healthy, the strategies for healing wounded skin are exactly the same as the strategies for preventing aging and wrinkles and dryness. Wound healing equals anti-aging. Wound healing equals health. What is wound healing really but stimulating the growth of things? That's what health is about. Stimulating the growth of fibers, stimulating the activity or the production of proteins from cells. It's the same thing. Wound healing is anti-dryness. Wound healing is anti-aging. Wound healing is anti-darkness or anti-pigmentation, hyperpigmentation. Wound healing is anti-wrinkle. Wound healing strategy, stimulating the growth of cells and stuff, is exactly what we want in topical skincare. If you can't put your moisturizer, anti-aging, anti-wrinkle product on a wound and get accelerated healing, what is that saying about your anti-aging product? All right, we'll finish up when we come back from our break and take your phone calls as well. I'm Pharmacist Ben, 844-236. All right, we are back on the bright side. Pharmacist Ben here. 844-236-6010 is our number. Get your calls here in just a second. I want to say, well, let's say, talk about wound healing. I guess we'll talk about wound healing tomorrow. Just want to emphasize the fact that pretty much everything we like about a skincare product, or everything we want in a skincare product, in one way or another involves the growth of tissue, the growth of stuff, which is exactly the same thing you want when you have a wound. And it's exactly the same thing you want from a product that's going to help you heal a wound. If you can't put your anti-aging wrinkle product on a wound and get accelerated healing, what is that telling you about your anti-aging product? About your anti-wrinkle product. Wrinkles are anti-wrinkle products are supposed to stimulate the growth of fibers, collagen, and such, and that's exactly what you want with a wound healing product. If you can't put your anti-aging product on a wound and get accelerated healing from a wound, that's an anti-aging product that isn't going to do much for anti-aging. when you put your wrinkle product, your anti-wrinkle product on your skin, you can't really tell if it's intact, if your skin is intact. You can't really tell if you're stimulating collagen or stimulating the production of connective tissue fibers, which is anti-wrinkle, which is what an anti-wrinkle product is supposed to do. You can't really tell. But if you put it on a wound, you can have an instant window to what's happening inside the skin. If you can put it on a wound and you get stimulated healing of that wound, then you know that you're going to get stimulated, accelerate the production or turn on the production of anti-wrinkle connective tissue fibers as well. That's why vitamin C and retinol are so darn important. You can put them on wounds and you're going to get an accelerated healing of the wounds. Now, you got to be somewhat careful with the retinol because it's so aggressive. But certainly once you have the wound pretty much covered, a little bit of retinol can go a long way towards accelerating the healing and repair and growth of skin cells, of connective tissue fibers, and as it turns out, also moisture factors as well. You can't put the retinol right on a wound. It's super, super stimulating, but you sure can put vitamin C on, at least fatty vitamin C on a wound, and get accelerated healing of the wound. And that's your guarantee that these are the ingredients that are going to be used by the skin to get you anti-wrinkle and anti-aging benefits as well. Tomorrow we're going to talk about something called hyaluronic acid. Many of you, if not most of you, have heard of hyaluronic acid, at least in terms of internally. Hyaluronic acid can be used topically, but it has to be used topically in a strategic fashion. I don't want to say used topically. It could be stimulated topically. If you put just hyaluronic acid from a skincare product right on top of the skin, you're not going to get much benefit. But if you use ingredients that turn on or stimulate your skin cells' production of your own hyaluronic acid, then you're talking. Then you're getting some serious anti-aging skin benefits. Anyway, we'll talk about how important this hyaluronic acid stuff is. And also, we'll tell you why hyaluronic acid is one of the most important detoxifying ingredients you can use in a oral supplemental fashion. We'll do all that tomorrow as we continue talking skin health and more on the bright side. All right, 844-236-6010 is our number. I'm Pharmacist Ben. You're listening to The Bright Side on the Genesis Communication Network. Let's go to Keith in New Jersey. Welcome. What's up, Keith?
Yeah, Ben, I have two questions for you.
Sure.
What could a person do if they have a slight heart murmur?
Okay.
And also, if a person had a calcium score of 307, what could they use to sort of remove the calcium from their arteries?
Well, there's a lot of things. First of all, let's take the second question first. It's actually a very common complaint, calcium deposits. Calcium metabolism is super tightly controlled by the body. When calcium starts to leak into the blood, you've got some chemical problems, chemistry problems, biochemistry problems. You don't have a calcium problem, you got a biochemistry problem. For whatever reason, calcium is starting to leach out of the bones, and calcium is not being taken into the cells correctly, and this usually involves toxicity. When the blood becomes super, super toxic, when the blood becomes saturated with poisons, especially sugar and other elements, other toxins, stuff starts to precipitate out. Calcium can precipitate out. This is the cause of calcium crystals. Toxicity in the blood, especially sugar. This is the main cause of calcium crystals. Also, when the blood becomes acidic, or when the body becomes acidic, when the fluids become acidic, calcium is leached out of the bones as the body attempts to raise the pH. Calcium has an alkalinizing effect. So between toxicity in the blood and acidity, which is also a form of toxicity, this is the main cause of calcium deposits. To compound all of this, when the blood vessels become weak, the body will use calcium as a sort of Band-Aid, among other things, also use cholesterol and other stuff, to kind of patch up cuts and weaknesses in blood vessels. So between weaknesses in blood vessels and toxicity and acidity, this is where calcium deposits come from. Now, you can use vitamin K to help stick calcium to the bones. Vitamin K is kind of a calcium magnet and attracts calcium to the bones. Vitamin D can improve the absorption of calcium into cells, but as long as you have the problem with toxicity, especially sugar, and perhaps a lack of oxygen, you're going to have an issue with calcium. So use vitamin K for sure. 1,000 to 5,000 micrograms of vitamin K2 a day. Probiotic bacteria can help you make vitamin K. Make sure you're getting some sunshine to get your vitamin D. Make sure you're using your ultimate essential fatty acids as well. You get some vitamin D there. And those are all strategies for helping keep calcium out of the blood. But most importantly, you want to consider calcium deposits as a sign that your sugar metabolism is starting to get thrown off, and that you may have an oxygen problem, and that you may have a general toxicity problem. If you're on prescription drugs, that could be a cause of toxicity. If you're subsisting on the standard American diet, in addition to sugar, there's all kinds of excitotoxins and other toxic elements in the food. You got to watch out for that as well. If you have digestive problems, especially if you're constipated, that can cause problems with toxicity. And then making sure you're practicing your deep breathing techniques. So, Healthy Start Pack, vitamin K. When I say vitamin K, I'm also including probiotics, in addition around 1,000 to 5,000 micrograms of vitamin K2. Vitamin D through your essential fatty acids, and also making sure that you're getting some sunshine on a regular basis. And then making sure that you're taking care of your sugar needs, especially if you know you have diabetes, or diabetes in the family, or you got sugar cravings, or you have any of the other signs of diabetes, including weight gain and blood pressure problems. Is this making sense, by the way?
Yes, it is. So
okay, is this the same? Let me just say one last thing. Let me just say one last thing. Is this all for you, or is this for separate people?
It's for me.
Okay, so the heart murmurs are a sign that that the blood, there's some kind of weird something going on with blood flow. It could be a narrowing of the valves or leaking of the valves, and blood is not making it through the valves correctly. It has to do with how blood is flowing through the heart, basically, and it could be related to the calcium deposits. So all of these are going together. The heart murmur is linked to the calcium deposits and calcification. They're all circulatory problems, blood problems. So a couple other things that if you have heart murmurs and you have calcium deposits, that's telling me a couple other things that I want to bring up with you. I didn't mean to interrupt. What were you saying?
I was just going to say that I have like a low pH, so I guess that's also caused by maybe toxicity in the body.
Well, how do you know you have a low pH? And yes, that's correct. But how do you know you have a low pH?
Like a urine sample.
Have you done it? Your urine was low.
The strip tabs to see.
Okay, got it. Yeah, it's all related. It's all related, and the heart murmurs are all related as well. Something's percolating in your circulatory system. I want to ask you a couple more questions, so don't go away. But you have a bunch of good information there. But let me ask you a couple more questions and maybe fine-tune my answer a little bit, so don't go away. I'm Pharmacist Ben. You're listening to The Bright Side on the Genesis Communication Network. Hang tight if you're on hold. We'll get to you when we come back from our break. Don't go away. You're listening to The Bright Side. All right, we're back on The Bright Side. I am Pharmacist Ben. 844-236-6010 is our number. We're talking to Keith in New Jersey about calcium deposits and heart murmurs. Calcification and the heart murmurs both have to do with circulation, both have to do with how blood is flowing through the body. Usually the heart goes boom, 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 boom. But if you get the swishing sound, that's what's called a heart murmur. It can be related to the thyroid. It can be related to problems with anemia. It could be related to problems with the heart having to work too hard. It can be related to valve problems, et cetera, et cetera. But basically, you're looking at an issue of toxic blood. The fact that calcium deposits are occurring in the same patient as heart murmurs tells me 100% you're dealing with toxic blood. Keith also tells us that his urinary pH is low. All of these are indicators that there's toxicity in the blood. The most important toxin in the blood is sugar, and it's the one that we have the most control over. I'm not sitting here talking about sugar to beat up on, because I'm Mr. Healthcare guy. I'm just saying that if you got a biochemical problem, if you have a health issue, the chances are pretty darn good if you're subsisting on the SAD, the SAD, the standard American diet, that you got a sugar problem. Heart murmurs, calcification, tell me something's percolating in the circulatory system. More than likely sugar is involved. Oxygen's also involved. Make sure you're practicing your deep breathing techniques, restricting your caloric intake, sugar intake, increasing oxygenation, all will have a thinning effect on the blood, and that can have a positive benefit for heart murmurs, and it can also have help you improve the calcium deposits as well. I'm sorry, Keith, go ahead now. You were going to ask me something?
Oh, great. You pretty much have answered all my questions there, Ben.
Good deal.
assume that's much sugar as it is, but I'll just eliminate it completely.
Well, it's sneaky. Sugar's very, very sneaky. Bread, pasta, potatoes, even ketchup and mustard, and it's everywhere. It's really hard to get away from it. But you go by your symptoms. Calcification doesn't necessarily mean that you're dealing with a sugar problem, but the odds are pretty good. A heart murmur doesn't necessarily mean that you're dealing with a sugar problem, but the odds are pretty good. Being an American in the year 2015 doesn't necessarily mean that you have a sugar problem, but the chances are pretty good.